Good afternoon, audience. I am Herman Rorschach, and today we're going to be talking about who I am, what I did, and my very famous and controversial Inkbolt test. And hopefully, at the end, I'll show you my Inkbolt test and perform it on you guys. I, psychiatrist Herman Rorschach, was born in Zurich, Switzerland on November 8th, 1884. I was known for my famous Inkball test. In 1921, I presented form interpretation experiment in my book on psychodiagnostics. Unfortunately, on April 2nd, 1922, my work ultimately came to an end when I died of peritonitis at age 37. Peritonitis is basically inflammation of the perineum, typically caused by bacterial infection either via the blood or after rupture of an abdominal organ. As stated earlier, we'll discuss my origins, which I already did. We'll talk about what I did in my experiment, then I'll recreate my experiment for the audience. The Inkbolt test. The biggest influences in my research were two people in my same line of work. One of them was a fellow Swiss known as Simon Hens. Simon Hens was a man who used inkball cards to break down patients' dreams or fantasies. Another influence was my colleague and contemporary Carl Jung, who was utilizing word affiliation tests to take advantage of the oblivious personality to understand what certain words mean to certain types of people. I then combined both their ideas to make my own experiment known as the Rorschach Inkball test. I was the first researcher to use inkballs to analyze how patients project their own associations onto seemingly random stimuli. To paint a better picture of what my friend Carl Jung did, he basically had words, and in these words they were put on cards, and he would show different patients the cards, and he would ask them what do they feel about the word and any immediate stimuli that comes from them on the spot. And then he would ask them a follow-up question as asking them why. And so hopefully the whole purpose of that was to figure out and deduce what the person's motives and how the person thinks in a way. The inkball test is a psychological test in which subjects' perception of inkballs are recorded and then analyzed using psychological interpretation and complex algorithms. Some psychologists use my test to analyze a person's personality, characteristics, and emotional functioning. It is usually employed to detect thought disorder, especially done when patients who don't openly express themselves. So if you have a stubborn patient who doesn't want to talk about what they have done or anything about themselves, you would try to understand them by showing them series of images and asking them why they think the images and what they are to get a better interpretation of who they are as a person instead of asking them questions which they're obviously not going to answer. In my own experiment, I had 300 test subjects and 100 control subjects. I gave the test subjects 10 images, half in color and half in black and white. I would quickly ask them what they feel about the image, and this would all be for a few seconds. And then afterwards, I would come back after the whole experiment is done with and ask them why they feel about that, why they feel a way towards a certain card, to the certain image, so I can get a better perception and idea as of who they are and their cognitive thinking skills. Now it's time for you to try. Now, what do you see in this image over here? Since this will be going by quick, if you said a bat, moth, or butterfly, you have chosen the most common answer, which most likely means that you're sane. And by the way, people think that this test is controversial because they believe that the result of the test are often subjugate, which they believe that the results aren't typically fair to call someone insane or sane depending on their answers towards images, which I think that is preposterous. I believe that this test will help me identify which one of you guys are the crazies and which one of you guys are actually thinking human beings. Now, what do you see in this image over here? If you said this was some kind of animal carpet, bear carpet, you are considered normal. If you said anything else, unfortunately, you're not. However, this can be taken a step further in deductive reasoning. If you said things that correlate with monsters or demons, we can assume that you had a horrific past and find figures like these to be scary. Now let's move on to something easier. What do you see here? If you said a skull, then you're considered normal. And finally, for our last experiment, or last question in our experiment, what do you see? This one I happen to like because there you can see two images. At the top, you can see a bat, and if you look at the whole image holistically, you can see a giant smiley face. If you said neither, then unfortunately you're crazy and you shouldn't be here right now. But this is my test. I am Herman Rorschach, and thank you for this opportunity to demonstrate my work.